I'm Dr. Harvey Shiffman, and this podcast explores the powerful connection between advanced dental laser technology and whole body health. In each episode, we speak with leading clinicians, innovators, and wellness experts about how modern dentistry is transforming patient care and improving lives. This is Talking Dental Lasers and Wellness, where dental technology meets whole body wellness. Hi, I'm Dr. Harvey Shiffman. We're here at Boynton Laser Dental Center in Boynton Beach, Florida. Our practice has more of a holistic, functional point of view. We want to find out what the root cause of our patients' problems are and not just patch things up. So we ask a lot of questions. We have patients fill out questionnaires to try and really find out what their problems are. And sometimes it's as simple as, having weak tongue muscles or a weak airway, or they need some myofunctional therapy. So these are the things that are kind of like stepping out of the box of typical dentistry and why our practice is unique. For over 20 years, we've been using infrared lasers to do traditional dentistry, laser surgery. We treat sleep and airway, snoring, sleep apnea, and also facial pain. The area of facial pain is what really led us towards investigating vagus nerve dysfunction. A lot of our patients would come in with very specific symptoms other than just jaw pain. And once we did all of our questioning of them and examining them, we come to find out that a lot of the symptomatology they had were indicative of vagus nerve dysfunction. The vagus nerve starts up in your brain, travels down your neck, through your chest, and into your abdomen. And everything in between is controlled. 80% of the information that goes to your brain through the vagus nerve comes from your gut up to your brain. So this feedback mechanism controls inflammation, abdominal movements, contractions, that type of thing. It affects your speech, your larynx, um, inflammation, anxiety, heart rate, breathing. All these things are affected by the vagus nerve. Vagus nerve dysfunction shows up differently in different people. Could be anxiety, um, rapid heart rate, sweating, difficulty sleeping, stomach issues immediately after eating, or before leaving the house. You have your breakfast, get into the car, and all of a sudden you got a stomach ache. So these things are all related to the vagus nerve. When a patient has chronic vagus nerve dysfunction, they're just not in their happy place. They can't calm themselves down. Their anxiety is running rampant. Um, Having those kind of conditions long term puts you into an acute state of dysautonomia is also part of that too. But it puts you into a chronic state of discomfort, and you're just not happy with your body and where you are and how you're functioning. So the VagusLase was developed to treat acute vagus nerve dysfunction, to help the patients calm down, to be able to self-regulate, to learn self-care techniques that we include in our treatment so that they can handle this themselves. And periodically they do come back and see us for maintenance if they shift more into an acute phase. So we're looking at a balance between the parasympathetic, which is rest and digest, and the sympathetic, which is fight or flight, parts of the autonomic nervous system. A lot of our patients show issues with tinnitus, ear stuffiness, Lyme's disease, POTS, PTSD, some types of ADD and ADHD, obstructive sleep apnea and snoring, irritable bowel syndrome, and some types of arrhythmias can be related to vagus nerve dysfunction. VagusLase is a gentle, non-surgical laser therapy designed to stimulate and balance your vagus nerve, which is the body's main communication pathway between the brain and your vital organs. We use a 1064 nanometer infrared laser delivering targeted multi-site bilateral photoneurobiomodulation to help support optimal nerve function and nervous system balance. VagusLase is designed and we use it for patients that have acute vagus nerve dysfunction. They just cannot break that cycle of the shift into the sympathetic side of the nervous system. So VagusLase allows us through therapy to break that cycle and help the patients shift to the parasympathetic side, which is calm, rest, and digest. So once they're able to do that, then, as I mentioned previously, we teach them self-care techniques. We have alternative devices that they can use at home. And periodically, if they get an inflammatory situation that shifts them back to the sympathetic side, we can always do maintenance treatment for them using the VagusLase protocol. The majority of our patients are adults that undergo VagusLase treatment. We do have a specific protocol for children called VagusLase Junior, and the energy settings are lower, and we kind of walk the children through. So that's more appropriate for the ADD, ADHD patient and patients that have other behavior disorders. So the VagusLase Junior would be appropriate for them. Patients ask us, what does it feel like? Does it hurt? Is it hot? Is there a residual discomfort from VagusLase? So what you will feel is a warming sensation on the skin. Each area is treated for approximately a minute, and the temperature does build up a little bit, but it never gets uncomfortable. And once the treatment is done, that warming sensation goes away. Once we're done with the therapy, we allow the patients to sit in a dark, quiet room, 5-10 minutes, just to really let themselves balance out before we let them go. And on the most part, most patients don't have any post-operative discomfort or any issues. All right. The important thing is to stay hydrated, work on their circadian rhythm to get improved sleep quality and just metabolic functioning also, because that all comes into play together. The healthier we keep our body, the better we function. Hi, I'm Dr. Harvey Shiffman. We're here at Boynton Laser Dental and Wellness Center with Cindy, and she's going to tell us about her experience with the VagusLase procedure, what brought her to have the treatment done, and what her response has been.
Okay, so I was having a lot of anxiety and a few other things I didn't know were related, probably, but initially was because of the anxiety.
Okay, and how did the treatment feel?
Well, it has reduced the anxiety a lot. I was also feeling um, not depressed, but sad. I have also noticed an improvement in my mood. Um, Also, I have noticed a lot of improvement in PMS and all the period related symptoms I was having that I didn't know was probably related to
to your situation.
Yes.
Okay. Everybody presents differently. Sometimes it's autoimmune diseases, sometimes it's trauma, sometimes it's just life stress that kind of sets off our the balance between our sympathetic and parasympathetic nervous system. The VagusLase procedure helps shift us back into parasympathetic. How did the treatment feel?
It's painless. The treatment was painless. It just feels a little warm in the area you were working, but it's really fast and painless.
Okay, well that's important that it's comfortable too. How long do you think that the results lasted after each treatment?
Well, it has lasted until today. I don't remember when was the last time we
It's
did this.
it's been several weeks since the
Yeah.
last treatment.
Mm-hmm.
So I would say that the lingering effect is good.
Mm-hmm.
We did several treatments to start to take Cindy from the acute phase that she was in, and we actually she did a maintenance today with the Pulsetto device. So
Mm-hmm.
how was the Pulsetto?
It felt good, also painless, and it was also fast.
Great. The Pulsetto is one of the devices that we recommend for maintenance once we've gotten the patients out of their acute phase with the vagus nerve dysfunction. And this is something that they can use at home if they desire, and seems to be a good adjunct to the treatment that we're doing with VagusLase. VagusLase, we're using infrared lasers, laser energy, so it's light energy, concentrated. It does feel warm. The beam is invisible, but it looks green on the skin when you're having it done. But actually, the laser itself is invisible, and we're really happy with the results that we're getting with our patients.
Mm-hmm.
Thank you very much, Cindy.
Thank you.
Thank you.